Hello, I'm Suzanne James. Welcome to Nightshift, the podcast where we talk all things voluntary assisted dying in Australia. The Commonwealth veto of the Territory's rights to legislate VAD was only recently overturned by the Restoring Territory Rights Bill 2022, which was made possible by the diverse crossbench following the 2022 election. The Voluntary Assisted Dying Act 2024 for the ACT was subsequently passed in the ACT Parliament on 5th of June 2024. VAD therefore commences operation in the ACT on this coming Monday, the 3rd of November 2025. To talk to us about its implementation in the ACT, my guests today are that's Treasurer of Dying with Dignity ACT, Mr. Tony Whelan. Welcome, Tony.
Thanks, Suzanne.
And our expert healthcare consumer rep and voluntary assisted dying advocate, Dr Adele Stevens. Welcome, Dr Stevens.
Thank you. Hi.
Thank you both for joining us. Dying with Dignity ACT came out of the original ACT Voluntary Euthanasia Society, which started in the late 80s. It became the ACT branch of Dying with Dignity New South Wales in 2009, then independently incorporated as Dying with Dignity ACT in 2012. So like everywhere else in Australia, voluntary assisted dying has been a long time coming in the ACT for supporters and most importantly, people who are suffering from a terrible terminal illness. So starting with you, Tony, tell us how long you've been involved in voluntary assisted dying advocacy, including with Dying with Dignity ACT, and what are the things that keep you motivated to advocate and act as a board member?
Suzanne, I'd been aware of how people could have an awful death after witnessing my mother's final hours in 1995, but I didn't become involved in end-of-life activism until 2006, when I quite accidentally met Dr Philip Mitski from Exit International while managing a sports event in Darwin. But I joined Dying with Dignity in 2010 and took on the role of treasurer in 2016. What keeps me motivated is coming into regular contact with good people whose lives are being reduced to misery by illness and incapacity. And I have a firm belief that wherever possible, we should be allowed to have some control over how well we die.
Adele, you're considered one of our most renowned experts in healthcare consumerism, and you also represented the Healthcare Consumers Association on the ACT Legislative Assembly inquiry into end-of-life choices in 2018. So how long have you been a VAD advocate and Dying with Dignity board member? And at what point in this ACT history did you genuinely feel that voluntary assisted dying was finally going to happen?
I have been a long-term advocate of voluntary assisted dying, which probably grew out of two things. One, like many members of Dying with Dignity and Exit, I have seen both my parents, loved ones with bad deaths, but I was also interested in palliative care, been an advocate for both things for over 10 years. I don't know if you know, but we had a voluntary assisted dying bill back in the 90s, which didn't get up because of the federal parliament. And we were very pleased to see the territories return to the right to make our own laws. And so that was the beginning of recognising that we could have voluntary assisted dying in the ACT. So both the territories were very early in having proposed voluntary assisted dying laws, but because of the federal government, we weren't allowed to go ahead with it. And I think I saw it really, we had a Labor member, Tara Cheney, who pushed very hard for voluntary assisted dying. So her support in the government has been really helpful. And yeah, so it was great in June last year when the legislation passed.
So it now commences this coming Monday on the 3rd of November, and the ACT Health website would indicate that the infrastructure obviously is very well in place. Tony, notwithstanding VAD is not yet fully operational down there, are you generally satisfied with the public information and the ACT Health website accessibility for people who are interested in VAD?
Suzanne, I think the ACT Health website pages are adequate. It's hard to say how effective the public information is because it's a case of no matter how much PR is done, there'll always be some people who don't come into contact with the messaging. I understand ACT Health have been working with the Canberra multicultural community to help get the message across to people whose first language isn't English, for example, which is an important audience to address. I do suspect, though, that there will be many people who haven't investigated the eligibility criteria and who might think that VAD is going to be easy to access, which of course is simply not the case, because the criteria are strict. And although we don't have a fixed time prognosis requirement like the States, our approaching the end of life criterion is rather vague. And the clinical guidelines issued by ACT Health disappointingly say that a person diagnosed with a terminal condition expected to deteriorate over the course of many years would not be approaching the end of their life. So I fear that some practitioners may interpret that clause in a conservative fashion, which would make it just as bad as the pointless 6 to 12 month prognosis that applies to the States.
The ACT doesn't have a gag clause, do they? I know that the Victorians Parliament's currently looking at an amendment to get rid of theirs. You don't have a gag clause in yours?
No, mercifully we don't.
Okay, so the doctors are able to openly discuss it as an end-of-life option with their patient, as it should be.
Yes, that's right.
Now, Adele, I'd like to ask you about the infrastructure for medical staff, because everywhere in Australia, Tasmania accepted, have online portals and things in relation to how doctors process the applications. So what online infrastructure is in place for VAD doctors and for health professionals in the ACT? Are you happy with that? Do you feel they've got the necessary online tools?
So I should start by saying who can be an authorised voluntary assisted dying practitioner. So that can be a doctor or a nurse practitioner, and they can do the first interview and the consulting interview. There is a dedicated online management system for voluntary assisted dying for those people who have done the training. And I might say, I think it's been encouraging to see how many people have stepped up. Back in August, we had about 20 authorised practitioners. Another training session for authorised people in September and October. So, and so the authorised people are not only the ones I've mentioned, doctors and nurse practitioners, but also registered nurses and also the pharmacist, of course.
Now, I'd like to talk to you, Adele, about palliative care. Is it your understanding that people already working inside palliative care in the ACT are fully on board with VAD, and do you believe the new system fully supports that cooperation?
When the legislation passed, the government allocated money for implementation, so they had an implementation task force. And on that implementation task force has been a number of people who have been previously palliative care leaders. They are committed to seeing both palliative care and voluntary assisted dying working together. But there has to be a number of options for people how they choose. But like elsewhere, we do have that clause that if you personally, as a practitioner in, say, palliative care or the hospital, if you have conscientious objection, you don't have to be involved. The government set up a navigation service. And what the task force did when they first were created, they went to the other jurisdictions, to the states, and had talked to them about what they'd set up, learned from them. And so, like the other jurisdictions, we have a navigation task force. And I think that's going to be very important. The website's quite good, but as an 80-year-old, I'm not too crash hot with websites. I think I would be, if I was new to this, I'd be Googling the number of the navigation care service and ringing them up.
That's excellent advice, and it's also another reflection on why it's so important that we not have GP gag clauses in relation to VAD legislation, because anybody should be able to speak to their doctor about any legal end-of-life healthcare. Speaking of public information, I'd like to ask you, Tony, now, as you and I both know, advocacy services and organisations get contacted by all sorts of people seeking help and information. I'd like to focus at the moment on carers. Griefline has recently set up a counselling service specifically for those grieving the loss of a loved one who died using VAD. And carers are often the people that bear the load, despite the best efforts of aged care packages and home care services and everything else. It's often the carer who is caring for the person who wants to die at home that takes the primary load. Does the ACT have any specific information or support in place for carers of VAD patients who may be looking after them at home? And where would you currently refer them if they asked?
Suzanne, in terms of emotional support, the government's website pages about VAD rather, do have a list of grief support contacts, and they include Griefline. And as you indicated, Griefline uniquely has national online VAD support groups, which are facilitated by a grief and bereavement counsellor and supported by a lived experience peer from Dying with Dignity Victoria. So they also have downloadable support guides for friends and family to help with coping with grief before and after VAD. I don't know that other support organisations such as Lifeline are as well equipped to deal with the grief associated with VAD. So my first inclination would be to refer a person to Griefline. And these support organisations, of course, all need donations to keep running. So I want to encourage people to support Griefline with their money if they're able to.
I'd also like to bring to people's attention the availability of a service which I very much relied upon when my partner was dying, and that is Carer Gateway. You can look up Carer Gateway on any Google search engine, and that is a free nationwide service. It will direct you to your local carer service, and they have all sorts of information and assistance, including a limited financial package assistance for people who are carers and who are looking after anybody at home, whatever their demographic. So that's well worth looking up. Adele, what's your view on the support systems for carers? You must have over the years as a healthcare consumer person.
Yeah, we have a carers association here in the ACT, and they're great. What the government did when they implemented, as part of implementation, they created a consumer and carer group, which they meet with online about once a month or every couple of weeks. Here I'm in bad with detail, and I have a feeling that someone from Carers Association is on that group.
Okay. You've been listening to Suzanne James on Nightshift. Thank you for joining us. See you next time.